My name is Terry Bremner, and I volunteer and I advocate for the millions of Canadians that suffer from chronic pain. Chronic pain is a disease. It's very complex, it's confusing, it's very difficult to treat, and it takes the hands of many, many specialists. Um, People that suffer from pain in Comox, Victoria Island, or St. Anthony, Newfoundland, all experience the same struggles, hills, hurdles, and obstacles on a daily basis. What causes the chronic pain? It could be a motor vehicle accident, it could be an accident at home, an accident at work, it could be nerve pain, back pain, fibromyalgia. There's many different places that the pain could start at. These are a number of other pain conditions that people suffer with chronic pain. The facts: 1 in 4 Canadians suffer from chronic pain on a daily basis. Chronic pain is pain that persists past a 6-month period. There's long wait times to see the specialist for us. There's no blood test to test for pain. And it's discriminatory on the age. It doesn't matter how old you are or the severity due to your age. The consequences of chronic pain, well, it affects us physically and socially and emotionally, our mental well-being and spiritually. And the impact had effects on our career or our job or our benefits. For sure, it had effects on us financially and the relationship with our family and friends. We wear a mask on a daily basis, and it's a huge challenge, and only few people can see through our masks. If we were in a wheelchair or had crutches or a cane or cast or brace, you would probably assume that that person would be in pain. Though chronic pain people suffer similar symptoms, and we share those symptoms. It could be sleep. With the lack of sleep, it's only going to enhance the other symptoms, whether it's low energy or fatigue and muscle spasm, or our appetite, constipation from our medication. It affects our attention span and causes anxiety. It also brings along headaches and irritability and sometimes anger. Though it sure does play a toll on our memory, whether it's really short term or long term, it affects our memory. But most importantly is the path that we walk with major depression. And depression, mental health, and chronic pain go hand in hand. And there's a few additional symptoms that come along with that, which is the confused thinking, decision making becomes very difficult, and the isolation away from others. The disease is invisible. It can't be seen, and we did lose our job, and some have lost their houses and their spouse and even their pay that came into their home. But we have to become aware of and have knowledge of the different type of treatments and therapies that are available. There's the pharmaceuticals, the pain medication, there's nerve blocks, there's physiotherapy, there's massage therapy, and homeopath doctors, chiropractor, acupuncture, naturopath, and many others. Though as chronic pain individuals, we have tried many different treatments trying to get rid of our pain, though it's like we're spinning plates and running from one treatment to another, and we have to slow down and consider that what are we getting the benefit from. So rather than having too many going at the same time, maybe to slow down would make you have a better decision on whether or not that treatment is of help to you. Gone for many people is the opportunity to have benefits. The benefits have been taken away. It becomes very, it's expensive, and the accessibility part, when you don't have your paycheck, becomes very strainful. There's self-taught therapies that are out there. When you look at yoga, and started 5,000 years ago in India, that's a great means of relief for many Canadians. The meditation back in the 3rd century with the Buddha, Again, another successful means of treating chronic pain. Qigong, which is a Chinese deep breathing life energy treatment, and I've seen many people get a benefit from attending Qigong classes. Though there's a free medication out there, and that free medication is laughter. And if we were to turn on a Just for Laughs gags and started watching, and all of a sudden we have a chuckle and at one of the videos, that releases the endorphins into our body, which go directly to the pain receptors and give us some relief. I've had an opportunity of meeting many chronic pain specialists across the country. I've talked to them and wanted to find out more about how patients can become the number one patient with the doctor, and what we should be bringing along. Most all doctors said that we should be prepared and be proactive. Just because you're seeing the pain specialist doesn't mean that you're going to get the cure that day. There's only certain things that can be tried. Though if your appointment was tomorrow and you're probably not going to sleep too well tonight thinking about your appointment tomorrow, your doctor's not losing sleep over you, because they're only going to review your file when they're walking in to the examination room. Though we can ask the doctor to put down the pen and put down the papers and have a heart-to-heart. All records that deal with our health and any benefits that we may have go through the doctor's office, and it's essential to know what information is being put down on these papers. Though in asking them how do we become the number one patient and getting their reply, I myself have utilized an idea that has been very productive for not just me but for many others. And what it entails is to take a blank piece of paper and fold it over into a book style, so that you can use this as a book and you can gain a lot of information. Inside of your own personal pain book here, you're able to list down all the symptoms that you have. You're able to list down all the treatments that you've taken. You can list down all the medications that you've been on in the past. And you can also talk about you have appointments coming up, and also the most importantly is to make sure that we get our refills before we leave the doctor's office. So basically your folder would look like this, and you're able to list down the different things that you deal with on a daily basis, and you become more proactive and more prepared when you're going to your doctor. The doctor wants to work with a patient that is involved, and it's very important, and that's just one way to do it. And you could take this piece of paper and you could tuck it into your purse or your pocket, and you can know at any time, if you're asked the questions of what your symptoms are, then you'll have all those symptoms, because there's too many to remember. We have to be aware of being a scorekeeper ourselves with a pain scale. On a daily basis, we should know what our pain scale is, and each season as it changes, we tend to go out and do a little bit too much, and we have a flare-up, and those flare-ups usually go for a very numbered of days and severity. So if we have a pain scale and we're able to follow it by putting a little score up into the calendar on our fridge or in our cupboard, then we'll be able to mark down when our flare-ups are occurring, what caused them, and how better we can react to them. And that enables us to regain control of our pain. We can count on one hand how many people have to know why we take our medications and why we have these treatments, and why we need lots of rest or the importance of sleep. But we can count them on one hand that these people should know this information. If I was age 65 today and I was healthy and active and I received a golden watch and a handshake, I love watching sports, and I'm sure that I'd end up in a lazy boy chair with the remote control going from one sport to another. Though eventually, from not moving, my tendons and my ligaments are going to shorten, and they're tightening, and my muscle tone and my cardio is all altered. That's a 100% healthy person stopping what they're doing. It's very important that as chronic pain sufferers that we are moving, and that we are attempting to better ourselves and our muscle tone and our cardio. We can use our stairs in our house or in an apartment. We could use a chair or even a can of soup. Just something so that we're moving. We could walk around the block. So these are all individual goals that each person should take time to find out what works for them. We look around at our pets, our dogs and our cats. And the first thing that they do once they get up from a rest is stretch. That also is very important to chronic pain people, that we go and we stretch. Stretching is just as good as doing the exercise. So I challenge all chronic pain people to volunteer for one day, 1 hour, 1 week, to someone else that is shut in, doesn't get out, doesn't get visitors, but could really use a visit from someone from the outside. If you're able to get in that situation and you go and you visit Mary and spend an hour with her, and then you tell her that you're coming back the following week. Mary's going to be very surprised and shocked that you're going to come back again to visit her. Though the feeling that you get once you leave Mary's house and you get into your vehicle to drive away, the heartwarming effect to know that you're helping someone is overwhelming. Volunteers don't necessarily have the time. They just have the heart. We're responsible for our own health. We're not just a number. Many of us have watched the TV series Star Trek with Captain Kirk. Well, that spaceship is very large, and if it happened to crash into a planet, the fault would be that of Captain Kirk's. In real life, we're the captain of our own spaceship. And whether we crash or not, we have lots of control over that. We have to accept ourselves as we are today. We have to develop coping skills and strategies and distractions just to get through the day a little better. We have to create habits. If we want to create a new habit and we put our hands together like this and we take them apart and move up a finger and put them back together, it feels as though we're missing a finger. Though for the next 21 days, if we get up and when we go to put our hands together, we do it with the finger above, after the 21 days, that's the way that you will put your hands together. We have to focus on what we watch, what we eat, and what we believe. We have to have some assistance in our mindfulness in decision making. And in making major decisions, you should talk to one of those 4 or 5 important people just to make sure the decision you're making is the proper one. Sometimes we feel that things couldn't get any worse. I had a doctor's appointment in Toronto to see a pain specialist, and walking through the door, I was feeling okay that day, though I seen someone in a wheelchair and they had a cast, and someone was on a stretcher and they had an IV, and there was even an individual walking with an IV pole. And I thought to myself that things could be worse. When I got onto the elevator, a hospital worker was behind me with a large machine that he wheeled on. And it had lots of hoses and plugs. And once the doors closed, I told the man that I'm glad I'm not hooked up to that machine. He said, "I'm sure you are glad." He said, "This is an industrial floor polisher." Now that may sound funny, though there are people in hospitals that are hooked up to machines just like that so that they can survive. I hope that you enjoyed the presentation, and I ask you please to visit the Chronic Pain Association of Canada on our website and have opportunity to educate yourself further. Please share with your family and your friends. Thank you.